Hello, and welcome to another webinar hosted by Fullscript. My name is Dr. Alex Keller. I'm the medical director of Fullscript, and I am super excited to be hosting our esteemed guest, Dr. Rob Silverman, today. Dr. Rob is a chiropractor and clinical nutritionist, international speaker, and the author of an awesome book, Inside Out Health, A Revolutionary Approach to Your Body, which was an Amazon #1 bestseller in 2016. If you haven't checked out this book, I would. It's really an awesome overview of health. It's both a great resource for practitioners and for patients just to get an in-depth perspective on functional medicine. So Dr. Rob has an extensive list of educational accomplishments, and I'm going to be talking about those in a second, but they include 6 different degrees in clinical nutrition, and he also maintains a busy private practice as founder of Westchester Integrative Health Center, which specializes in the treatment of joint pain using functional nutrition along with cutting-edge, science-based, non-surgical approaches. And so just to highlight some of the additional training and certifications and degrees that Dr. Rob has gone through, which I have an extreme admiration for because it shows Dr. Rob's passion for the work that he does in this field. He's a doctor of chiropractic medicine. He's a master's of science in clinical nutrition or human nutrition, certified nutrition specialist, certified clinical nutritionist, certified strength and conditioning specialist, NASM, certified corrective exercise specialist, certified sports nutritionist from the International Society of Sports Nutrition, diplomate with the American Clinical Board of Nutrition, and a diplomate with the Chiropractic Board of Clinical Nutrition. That is a long list, and that's not even all of them. Dr. Rob, you obviously have an extreme passion for what you do. Welcome, sir, and thank you for joining us today.
It's great to be here. Thanks for having me so much. I'm truly excited and honored to spend the next 60 minutes with you and everybody out there. I can tell you that I've been anticipating this and excited about it since you guys gave me the go 6 weeks ago.
Awesome. So great to have you here. So why don't we start with a little bit of your background and how you got into first chiropractic medicine, but then doing everything that you're doing now with functional nutrition and functional medicine in general.
Yeah, absolutely. Thanks so much. People always want to know your story and your why. My why is real simple. I suffer from congenital torticollis. You probably can see that. It's asymmetry of the neck. I was damaged at birth. So that was kind of tough. I grew up in New York in not a really good section. So not being like all the other kids led to a lot of teasing, and became very sensitive about it. Was hoping to have something done about it. Finally found somebody at 18 years old that suggested to cut the neck and pull on the muscles. I didn't want to do that. My mom didn't want to do it at the time either. So I went to college, played basketball in college, and I went to a chiropractor. And I went to a chiropractor, and he changed my life. I laid down at 21, and I don't want to sound corny, but I got up and I knew that's what I wanted to do. He talked to me, he helped me, he made me feel better. It was something that I had never experienced with a doctor before, and I always held doctors in esteem, and I always had very positive experiences with doctors previous to that. So when I finished college, I have an accounting degree. I knew I wanted to trek into chiropractic school, and I did. And all through chiropractic school, you know, I was exposed to some other things, and I knew chiropractic was great, and I wanted to help people like that chiropractor helped me, but I always wanted to spread my armamentarium and add different things to it. So when I was finished, I incorporated a lot of nutrition. So the first thing you do when you do nutrition is you do a little musculoskeletal chiropractic. You do some weight loss because everybody asks for it, kind of common. And then you start seeing some tougher cases and everything. And I'll never forget the one time that really pushed me over the edge to really delve into functional medicine. I was sitting with my 5-year-old niece. She's from Singapore. Literally, she was with a comic book and a drawing book. And I'm sitting there and I'm, you know, trying to have an adult to child conversation, except I felt the roles were reversed. And I simply said to her, I was complaining. I was complaining about a patient. And she just looked at me as innocently as she can. And she said, you know, you're a doctor, you're supposed to know. And my jaw dropped. My jaw dropped. I just didn't know what to do at that time. And of course, as opposed to trying to figure it out, I tried to make some more excuses. And she looked at me and she said, you know, mommy says, if you're not good at your job, find another one. So I knew then I mean, you know, the 5-year-old put me in check. I knew I needed to delve into what they call functional medicine, but I like to call functional nutrition. Start analyzing the body, start getting to root cause resolution, start being able to tell that patient the reflection of their health in the mirror and how we wanted to change it. From that day on, I was on that mission. So my mission initially was to help people, and it expanded to help people by adding functional nutrition into my chiropractic tools.
That's amazing. And aside from functional nutrition, you also use a whole bunch of these innovative tools now and techniques that are helping people avoid surgery and going down that deeper path, right?
Absolutely. You know, I still use my hands. We adjust, we do soft tissue. I use instrument assisted. I'm a huge laser proponent, found it to be quite effective in healing the body from the inside out. Really works with all chiropractic, you know, non-surgical advances. I mix in the biochemistry. So if I were to say to you, you know, how would I describe myself? I'm that guy who looks at the mechanical, adds the biochemical, and tries to get clinical outcome looking at those two things.
That's amazing. Not necessarily that novel for chiropractors to do that, but to connect that many dots in one practice, that is quite novel. And I mean, again, you can see it just behind you, all the different certifications that you have and everything you're plugging in. It's a special experience, yeah.
Yeah, those my mom's coming in a little while to get a treatment, so you know we have those up there for her. Absolutely, you know, one of the things that I found, you know, the world is growing, information grows so much, you know, social media, what we're doing now. So we always want to try and be on top of it and give the patients, the doctors, the leading edge, and that's why we do webinars like this. To really get to the meat of the matter and trying to share some clinical takeaways, some protocols. You know, I'm a big believer in taking the science and bridging it to what I call Monday morning, next day application.
Absolutely, yeah. And going back to the original term of doctor is teacher. You know, you're doing a lot of that, not only with your patients, but with practitioners. We're just talking about the fact that you're at a conference next week presenting, which you do very often. You wrote a book. You have a new book coming out this year.
Yes.
We'll talk about that in a second. So speaking of education, let's dive into it because we have a lot to cover today. We're touching on a lot of different topics, and I want to make sure that we get through the content so our listeners get to learn from you the way so many people have. So we're going to start off first talking about the microbiome and the gut and gut health and how the microbiome has this overall effect on health and disease. Can you start with something on that?
Yeah, absolutely. And, you know, I'll ask everybody out there, do you have the guts to be healthy? What have you done for your guts lately? So your microbiome, and we're talking to doctors now, but what I like to do is I want to give you the information, but I want to give you the information so you can disseminate it to your patients because there's always that loss in translation. So our microbiome, 80% of our immune cells are in our gut. It's where our macro and micronutrients are absorbed. Our gut is, without question, when unraveled, at the surface area of a tennis court with a single layer thickness of a paper towel. So when you think about that, that's protecting the outside of the body, theoretically, from the inside of the body. Not that thick, a single layer. So when we talk about the intestines, let's define there's the small and the large intestine. The small intestine does 90% of the work. It has a very thin mucosal lining. That's why the small intestine is typically implicated in so many of our gut issues. The large intestine doesn't do quite as much work. Large intestine is typically known to have IBS, IBD, small intestine, leaky gut. So let's wheel that back a little bit with that idea of leaky gut. Our gut is permeable. Digested foods, water, and nutrients are supposed to pass. The problem is when it becomes semi-permeable and it now becomes permeable, the problem becomes that too many things pass. Certain things pass like undigested food particles, bacteria, viruses, and the like. With that being said, our gut now becomes leaky. In addition to the concept of leaky, we have something called like a tight junction. The tight junctions open up and those particles pass. So just to give the 35,000 foot view, we can have what we call a leaky gut. We know our leaky gut can be that our intestines are too permeable, our tight junctions open up, or in theory, we can have a tear in the intestinal tract. So ultimately testing with symptomology and serum tests are really going to lead us down a path of where that patient is. But most people, unfortunately, have a leaky gut because the modern era with the foods that we're eating and the environment that we live in damage our gut. Again, it should be a pristine single layer cell that is the thickness of a paper towel.
Absolutely. And so when you start having a leaky gut, again, a lot of the listeners as practitioners probably understand this, but you start having things start to travel through the gut lining that shouldn't be traveling there. And that can start to lead to other types of conditions like autoimmune conditions. Can you draw, a bit of a stronger connection there in terms of when we have a leaky gut scenario, what kinds of autoimmune conditions can happen and how they start to transpire?
Absolutely. So when things pass our gut and because it's leaky or damaged, they go outside our intestinal tract. So our immune system, typically our adaptive immune system, which is something that we got about 10,000 years ago, has two buttons. One says self and one says foreign. So when the foreign button gets pressed, immunoglobulins bring antibodies and it attacks it. So it starts to attack it, and we have what we call inflammation at that level. When it goes and it starts attacking ourself, when it starts to attack structures, our knees, our organs, and things of that nature, we call that autoimmunity. And that happens very simply because the body gets really confused and our immune system gets confused because it's under heightened alert. And that with something called molecular mimicry, the protein sequences of these antigens, the antigens are the thing that pass the gut, come out. Their protein sequence of them are almost identical to certain particles in our body. Sort of like a zip code. My zip code here is 10605. So the 10605 may be that food particle that passes, but my knee may be 10606, and the body starts to attack itself. And when it attacks itself, we call it autoimmunity, and that's kind of why it happens. So for me, if a patient comes in, the biggest things I like to do is manage and modulate inflammation to avoid autoimmunity.
Yeah, and your analogy is a good one. It's kind of one that I like to use with my patients as well, where if it's unfortunately not a pleasant one, but if you have a bomber that's coming over that has to bomb a specific area, right beside it, there might be collateral damage. And so if something looks very similar, feels very similar, and the immune system mistakes it, then you have that biomimicry type of situation.
Yeah.
Awesome. So we've set the foundation, we've set the groundwork of leaky gut, autoimmune conditions, how they start to connect. Let's start to talk now about how do autoimmune conditions and leaky gut tie into neurological issues and neurological diseases, because that's a lot of what you focus on as well.
Yeah, great question. The gut and the brain are intertwined. They're interconnected. It's a bi-directional connection. So when something passes the gut, it goes into your bloodstream. So I'm going to try and get up here. It passes your gut and goes into your bloodstream. So it makes its way up to the gut. Also, it's directional. So what most people don't understand, we'll take, you said neurological condition. Let's talk about neuroautoimmunity in the brain. So, but the fact that the gut and the brain are intertwined, the brain barrier, we were talking that a little bit before, or what we like to refer to as the blood-brain barrier, is made up of the same proteins as the gut. So whatever happens to the gut happens to the brain. Whatever happens to the brain happens to the gut. So if you have a leaky gut, you most probably have a leaky brain. Now, when you open the door to the brain, all you have is brain tissue, and it starts to attack the brain. So you can think of all the neurological conditions, multiple sclerosis, Alzheimer's, Parkinson's, and the like. There's a direct correlation between that gut health and that brain health. So for us in functional medicine, functional nutrition, it's almost, we don't have to talk about the gut anymore. It's sort of accepted. It's the patients that we still have to remind and explain. Everything now we do to our gut, we really want to talk and go right to the brain and get to the neurological issues there, or autoimmunity in the brain.
Yeah, I think this is something that we're not talking about enough. And with the work that you're doing in concussions as well, it's coming up more often, I'm sure. But the leaky gut and the intestinal permeability as a syndrome is something that patients are maybe more aware of. But the leaky blood-brain barrier is something that they're not as familiar with. So when you say that the tissues are very similar between the gut lining and the blood-brain barrier lining, can you just elaborate a little bit on that? Like what is actually the tissue that we're talking about, and how when you have the leaky gut start to happen, how is that directly connected into the blood-brain barrier as well?
It's so interesting that, we were talking about before, the layers of the blood-brain barrier in the gut are made up of the same protein. Okay. But deeper than that, the gut is connected via what we call the vagus nerve. Cranial nerve number 10, that parasympathetic nerve. It is your rest and digest nerve. Your gut communicates within a millisecond to your brain. That vagus nerve is very interesting because it goes from the medulla oblongata down through the transverse colon. It goes through your jugular foramen, it innervates your heart, it innervates your liver, it innervates your stomach, it innervates your pancreas. At the stomach level, it attaches to the outside of what we call your transverse colon. Now, it's interesting in that it's about 90% afferent. So obviously, if it's afferent, it's carrying to the brain. So the bulk of your messages in your body go from your gut to your brain, even though it is bidirectional. So it's 4.5 times the amount. So with the gut and the brain being a communication, the vagus nerve can sense, being so afferent, what's going on in your gut. It senses dysbiosis. Not only can it sense dysbiosis, after it senses the dysbiosis, it communicates with something called pattern recognition receptors. Toll-like receptor 4 is a great example. Essentially, they're immune stimulant receptors on the inside of your gut. It sends a signal to them, cascading all this innate immune responses. So therefore, the vagus nerve is a critical element, something naturopath that you are, chiropractor, MD, DO, we're all very familiar with it. We all have to start looking at and decide how that plays in the communication skills. Now, that's just one. We all know the gut and the brain are communicating not just through nerves like we talked about, but it's also autoimmune and also hormonal.
Right, yeah. And this is where it becomes a little bit more technical and trying to understand where exactly the problems are happening and working with the entire system to draw those connections so that you can enter your treatment plan where it's necessary. Yeah, the vagus nerve is obviously coming up a lot, and it goes the other way as well in terms of the migrating motor complex and making sure that digestion is still functioning properly going the other way, which can be affected too. But why don't we talk a little bit about what environmental and lifestyle triggers can actually affect both digestive leaky gut syndrome and also the blood-brain barrier syndrome.
Absolutely. We're going to get back to that migrating motor complex if we talk about SIBO a little later, because that's going to be a great preface to that. So things that injure your gut. Let's start real basically. Gluten, wheat, possibly rice. So I tell everybody, adhere to my GPS. No gluten, no processed food, no sugar. No dairy, no nicotine, no artificial sweeteners, no alcohol. There are 7 things right there. Flame retardants really can damage your gut. Glyphosate, which is in Roundup, is extraordinarily deleterious to your gut. It damages your microvilli, going to give you leaky gut, can lead you down a tremendous path of adverse health. BPA, phthalates. People don't realize it was a great point. Environmental plus food really can lead you down a path. So in my current book, she asked me, she being my editor, could you give me 25 things that damage the gut? I woke up and I realized it was at 52 and I hadn't covered everything. So there's a lot of things, unfortunately, that's damning to the gut, very ruinous, if you will, to the gut. But those are the big ones, if you will. By the way, clearly, non-steroid anti-inflammatories and obviously antibiotics. Those would be some of the ones. So you have to realize that we're not anti-antibiotic, no pun intended there. We just want people to know taking it prophylactically does not probably work for overall health, and if you take it, you've got to, repopulate your gut.
Yeah, so avoidance is one big part of the picture, but also the healing after the removal has been done as well is another component that we have to think about. And you have something called Dr. Rob's gut matrix, right? That is usually the first place that you kind of get into in helping to heal the gut lining.
Absolutely, my gut matrix. So I'm going to try and be as evocative as I can. So the gut is right here. I almost wanted to use a PowerPoint. So the gut's right here. So as we talked about it, it's very pristine. 80% of your immune cells are there. When the gut is compromised, things can pass and lead you down a path of immunity, or if you will, autoimmunity. Some of the items that are very particular is something called LPS. And most of our listeners know that, lipopolysaccharide. Lipopolysaccharide is on the outer membrane of the inside of the gut. It holds gram-negative bacteria on the inside of the gut. When lipopolysaccharide is expressed, it leads us down a path of systemic inflammation. It is extremely adverse and dangerous to overall health. In addition, which I'm sure we'll get into more and if we talk about SIBO, the gram-negative bacteria carries something called cytolethal distending toxin. That is 10 times more damning than LPS, and that is coming up in the literature right now. So when the gut has been damaged, look, if we'd like, can we call it leaky? Make it nice and easy. Leaky gut has shown to increase the amount of toxins to your liver. So that's my matrix going to your liver. 75% of the toxins that go from your gut to your liver go through via your bloodstream. 25% go via through what we call the portal vein. Literature has really indicated that an increase in LPS and leaky gut takes you down a path of increased insulin, insulin sensitivity, insulin resistance, diabetes, obesity, musculoskeletal issues. As a chiropractor, I told all my chiropractic brethren, someone comes in with a rotator cuff injury, someone comes in with a back injury. Yes, you have to treat the area, but you have to treat that person, and treating that person would mean treating their gut. Damaging the gut releases cytokines, as we talked about before, systemic inflammation. And those cytokines are, again, and matrix metalloproteinases, which are body's own proteolytic enzymes. They eat fibrocartilage. Those are your discs. That's in your rotator cuff. Leaky gut or leaky heart. 3 times the incidence of heart attack with an increase in LPS, and what we've been talking about it all day long. Leaky gut, leaky brain. Gut on fire means brain on fire. Decrease satiety if you have damage to your gut, increase neurodegenerative disease. And let's not forget the thyroid, true autoimmunity.
Absolutely.
On and on and on.
You just made like 60 different connections there all at the same time.
You got it. You got it. I needed that slide. We're going to do that next time. We'll get that
whiteboard. You need a
whiteboard.
slide or some sort of an infographic that you can send out to everybody, because it was amazing, right? And that's what a lot of people don't get. You know, we all see physical medicine cases where people have pain, chronic pain, acute pain, whatever it might be, but that connection between nutrition and the gut, it's just not often there when the people are thinking about pain and thinking about, you know, I've got a disc issue. Well, the disc issue is very much tied to your gut, tied to your liver, tied to these toxins that can be secreted, tied to your nutritional status, all of this. So yeah, we need some sort of an infographic from you. Whether you have it or not, we're going to develop it so that we can.
I will send you a PowerPoint of Stephanie sitting right here. She's hiding.
Amazing. Yes.
She just made a note to take care of it. And a disc is, I know we're limited on time, but a disc is a great example, because most people come in, 8 out of 10 Americans have lower back pain. It's something that every one of us has different types of practitioners, but all colleagues in the same common goal of helping people are going to see somebody with a lower back pain. And I can tell you this, you're never going to get your outcome unless you also fix their gut. And I tell all my medical doctors that, and they understand it. And we're bringing them in fold.
Yeah. Well, and again, like I mentioned before, you know, there are a lot of chiropractors, and chiropractors are often considered, you know, the back doctors, the ones that focus on back pain or all sorts of pain. But it's kind of like this shift is really just starting to happen now, where a lot more chiropractors especially are starting to think about, if I make an adjustment or I do any type of soft tissue work or something, if it's going to hold, I need to make sure that the foundations of health are there as well. And you're absolutely addressing those. So that's why I love the connections that you just made. I know we're doing a bit of rapid fire here, and it's going by quick, but I just want to make sure that we cover some of the common protocols that you'll use, nutritional protocols, with some of the more common musculoskeletal issues that you see.
Well, let's talk about the disc. And essentially, I usually do something in what we call the 3 phases of care. I make it very basic, in that the first phase typically is the acute phase. In the first 72 hours, inflammation is high. Then I go to what we call the subacute phase, where repair and remodeling are of prominence. And that's usually about day 4 through and including week 8. And then you've got your chronic conditions, which are 12 weeks, 16 weeks, years. And we always have the prevention and wellness. So in acute, I always recommend using some proteolytic enzymes, should be taken in between meals, really to take the cellular debris out of the way. I like a lot of natural anti-inflammatories at the beginning to manage and modulate the inflammation. Turmeric is it is one of the most versatile things you can use. Within the turmeric, ginger and boswellia, which decrease an inflammatory pathway, the 5-lipoxygenase pathway. Calcium, magnesium are great in a proper ratio. A normal ratio in a multivitamin, calcium is 2 to 1 to magnesium. However, it's inverted when you're talking about muscle spasms, which will usually be prominent in the acute phase. And in that acute phase, it would then obviously be a magnesium to calcium, 2 to 1. Fish oils, great choice. Take a little while to get in there. They're great. And something new to the market that a few companies are now pro-resolving mediators. They're the only thing we've seen to allow for the resolution of inflammation while allowing for the homeostasis between the initiation and the resolution of inflammation. And that's great. I front load a lot of that. Part 2, or that subacute phase, glucosamine and chondroitin, collagen, different selective kinase response modulators. Once again, turmeric is one of those. The collagen, I like collagen number 2. Collagen number 2 is big on joint. Collagen 1 and 3 is skin, hair, nails, and gut. So pick and choose as you will. Again, you would always continue with your fish oils. And chronic is the real issue that we get to. That's, believe it or not, when I actually dose a little bit higher and use specific, again, those fish oils, those glucosamines, and not to be too long-winded, but when we're talking about wellness and prevention, multivitamin, multi-mineral, phytomulti, omega-3s, vitamin D, probiotic, and a good green drink. That's something that you and I probably take every day, plus a few. It's something all the docs listening should probably take. So if it's good enough for us, why not share it with our patients?
So foundational health is key, but really looking at the different phases, acute, subacute, chronic, and being definitive in what you're using in those phases makes quite a difference. You list all of these different protocols and how you're dosing and what you're using in Inside Out Health as well, right?
I did it in my book, Inside Out Health, and what I'm going to do for you guys is once we're done, I'll rewatch, and I'm going to make a full protocol list and share it with all the viewers.
Awesome. That's perfect. Super great. So let's talk then about shifting back away from musculoskeletal. If you're dialing in on healing someone's gut, which it sounds like you're really doing as a foundational thing with most of your patients, you have this 7R step approach when you are trying to heal someone's gut. Can you elaborate a little bit on that?
Absolutely. 7R action steps, real simple. We're going to reset their lifestyle. We're going to remove pathogens. We're going to replace digestive and pancreatic enzymes. We're going to regenerate and repair the gut, or as I like to say, and seal. We're then going to re-inoculate. So notice there's a little bit of a change in the standard order, and I'll address that in one moment. Then we're going to reintroduce foods. And I can tell you, if we don't reintroduce foods that they may no longer be allergic to, if we don't give them something that they want to eat, they're not going to be our patient too long, because the door is a two-way street. And ultimately, we want them to retain their health. So reset. First thing you're going to do when you reset with somebody is you're going to change their lifestyle. Lifestyle is going to be diet. So ketogenic diet, a big proponent of a ketogenic diet, if it's right for that individual patient. Mediterranean is always a great choice. Those are the two that I go to most often if you're going to use the ketogenic diet. Medium chain triglycerides are a great choice, from coconut oil, C8 and C10. Trying to avoid the palm oils a little bit. Excellent choice. If you're on a ketogenic diet, you want to take a good magnesium supplement, add a little fiber just to make yourself regular. The Mediterranean diet's excellent, again, easy to follow. In addition, when I talk about lifestyle, let's get moving. How about 15,000 steps a day? How about some flexibility training? How about some gratitudes in the morning? I mean, I'm type A. Everybody knows that. If they didn't know that, they knew that in the first 30 seconds. I'm moving my hands. I'm pumped to be here. So it's a big deal for me to get that gratitudes and for me to, you know, I don't meditate, but I do certain gratitudes in the morning and get myself set, have my organic coffee, things of that nature. Remove. We're also number 2, we're removing the foods, but we're going to remove the bad bacteria. Diet's not enough. Removing the bad bacteria, we can do so with oregano oil, which takes care of the airway bacteria. We can take care of the dysbiosis of the bowel with berberine HCl. And in addition to that, I found very effective serum bovine immunoglobulins. They're actually putting the antigen inside the gut. By taking it out from inside the gut, you're now binding, or if you will, the mop of the gut. You're taking it out, so this bad bacteria no longer can be expressed outside. Great choice in the remove. Replace, you're going to replace with those digestive enzymes. For the stomach, you're going to do betaine, HCl, and papin. For pancreatic enzymes, protease, amylase, lipase, they're going to be great choices for pancreatic enzymes. Regenerate. We don't have enough time for me to tell you all the ingredients you should take in your powder, but the heavy hitters clearly would be L-glutamine, okra, nag, zinc, carnosine, because they all help in building the intestinal wall tract back, whereas you would take all your turmerics and the such, which would allow for an anti-inflammatory environment in the gut. Collagen, great choice to take at that point. Omega-3 fatty acids. Omega-3 fatty acids attenuate those toll-like receptors, and in addition, They also allow for biodiversity in the gut. Then you want to reinoculate. Genus, species, and strain. You just look up your probiotics and see which one is more strain specific. L. salivarius, Lactobacillus acidophilus, L. plantarum 299V. Now I want to stop, and people are going to say, Rob, you're nuts. But I've heard that one before. You're going to say you're nuts because you're doing the reinoculate after the regenerate. That's correct. Because as of October 28th, the literature said that if you had a damaged gut, and especially damaged by LPS, the good bacteria passed the intestinal tract and started you down a path on inflammation. So let's heal and seal. Now, if you wanted to take a probiotic just for dysbiosis, take Saccharomyces boulardii at that point, which will come up multiple times. It's a yeast, and that Saccharomyces boulardii is a yeast that does not affect the body as a bacteria. In addition, it eats up all the bad bacteria also because it's hungry. Last, don't forget, not last, but don't forget that we want to reintroduce. No gluten, no dairy, no sugar. That's out. I'm sorry. However, if you're no longer allergic to the foods and you did a food test, give it to them. Because remember, you may be allergic to foods because you had leaky gut prior. Now's a good time to know, reintroduce things that patients will like if they can eat it. No fried foods. And again, retain your health. I mean, it's as simple as that. Put yourself on that super 5, if you will.
So, yeah, boom.
Sorry about that.
We need another infographic just for that one too. But
Steph, write that down.
for those 7 R's, what's your approximate timeline typically? How long would it take to go through?
That is an outstanding question. So the realism is that I have it in 1 month because a lot of new docs are like, it takes too long. And the real issue is if you have leaky gut and LPS is expressed, it typically takes 3 months to heal. If zonulin, which is from the tight junctions as well, is expressed, and zonulin can be expressed as simply from taking NSAIDs in those tight junction damage, it's 6 months. And if you have an intestinal barrier injury and or autoimmunity, it could take up to 12 months. Now, I practice like you do. Hi, patient, how are you? 12 months. I'm sorry, where are you going? It was nice knowing you. Yes, you may have to switch them and put them together. So the timing will really matter on the extent of the individuality of that patient's injury.
Yeah, no, it's a really great point. And especially where you have a lot of practitioners who will apply, let's say, a 30-day elimination diet and then start to reintroduce after that. If you haven't done that underlying healing, you're actually potentially just causing the problem to happen again. An analogy that I like to use is when you have a muscle injury, you develop scar tissue, and that scar tissue tends to be a lot more brittle than the original muscle. If you go and start competing right away without breaking down that scar tissue, then you potentially will cause a re-injury, much more likely than if you take the time to properly heal the muscle. And same thing with the gut. If you don't give it those 3, 6, or potentially 12 months to properly heal, you're just going right back and potentially setting yourself back again. Yeah.
If you were to say to patients that if you had $10 million 1 year from now, that 1 year wouldn't sound that long, but they value their health enough to understand really not that long period of time, and it can be a lot less, and they'll feel better probably within a month. But those who do it are nodding their head like you and I, and those who are a little new and try to integrate it, we do share a 1-month program just to give it to the patient to get them started and to build the confidence with the patient, with you as a functional nutrition practitioner. And the reason I say functional nutrition is because, functional medicine is great, and Dr. Bland is everybody's idol, and we thank him for what he's brought. But, I like to use the word functional nutrition because not every practitioner that's listening can do medicine in their respective state, but they can do functional nutrition.
That's a really great point. Absolutely. I love that you said that. 2 quick questions before we jump on to brain health and concussion specifically. So first, with the 7 R's, the reset phase at the beginning, a lot of what you talked about, actually, just using another R word, but routine. Routine is huge, and getting people into a very consistent, good routine can be, one of the most significant shifts in their health. And it sounds like a lot of what you do is just getting people into that consistent routine.
Thank you for adding another part to my book. I do appreciate that. I think it's great. Reset your routine.
For sure. Yeah. So there's that. And the other question I had actually was with the reinoculation phase, do you ever use prebiotics as well alongside probiotics?
Yeah, that was a little miss on my part. You always want to give the pre and the probiotics, and you prefer to give them together. Prebiotics studied on their own have shown to decrease body fat, improve immune function. They're a critical element because you want to combine the pre and the probiotics, because the prebiotics feed the probiotics. You know, my dad had the best line. My 88-year-old dad, I was explaining to him why I needed to take a probiotic, and he said to me, so they're good renters in my bed and breakfast, as long as I feed them. And then they're great. And I'm like, you can't get it any better than that. So you've got to feed those probiotics with good prebiotics. You can get them from food typically, but you also would want a combination. You know, inulin always comes to mind first.
Absolutely. Good renters in my bed and breakfast. That is fantastic. Clinical pro. Awesome. Okay, let's transition over to concussions and brain health in general. So maybe just give kind of a high level review on concussions and how you're assessing and understanding concussions in your practice and what's going on in that industry right now.
Absolutely. You know, concussion is not diagnosed appropriately enough. There's about 4 million concussions now. About 500,000 concussions go to the emergency room. Concussion and traumatic brain injury are used synonymously. They're not. If I took a spear and put it in my head, that's traumatic, but it's not a concussion. Concussion comes from the whipping of the head. Remember, the brain is 3 pounds with the texture and consistency of Jell-O. Jell-O. So I did a Facebook Live and I took my wife's sugar-free Jell-O and I went like that and I told everybody I'm inside the head. So that Jell-O, your brain, my brain, whips back and forth, hits the hardest bone in your body, the skull, and in this whipping and ripping can rip up to about 50%. More commonly with women than men. We can delineate that if needed later. So this damage to the brain is tremendously decreasing in their ability to think. It rips axons. And unfortunately, so much of the old school people were not diagnosed with concussion. Many of the practitioners at the time they went to said rest is out, exercise is in for concussion. And when you have to look at the plethora of things to do to really get the clinical outcome in a concussion, it can be a little scary, but let me shed some light. I will say this about a concussion. Concussion is the window into functional medicine, functional nutrition, because as we said before, the brain and the gut are intertwined. So if you damage your brain, you damage your gut. If your gut's damaged, your brain's never going to heal. And hence the idea of why it should be a main course on everybody's menu in any functional medicine, functional nutrition seminar, etc.
Absolutely. Yeah, we'll tie that into our conversation about SIBO in a second as
Sure.
well. But I just wanted to quickly go back to what you said about the ripping concept. You know, I think that's something that's fairly novel in our understanding of concussions now too, because people used to always interpret that concussions were just a bruise in the brain, you know, just an impact where there might be some blood vessels that got damaged and, you know, potentially local pooling of blood, which causes neurological issues. But this concept of ripping is a relatively new thing as well. So can you expand a little bit on what happens to the axons and how nutrition will then be potentially used in order to heal these axons and heal the tissue of the brain?
The axons are ripped. So the shearing tears the axons and tears the brain tissue. So that's one of the reasons why we need nutrition, why we have to change their diet and give them nutrition, because we need to heal those structures. Now, what's interesting is how fast. And it's fast. Brown University did a study and found out that brain cells died within 6 hours or started to die. In addition, they also found out that zonulin is released 6 hours after concussion. And just to piggyback on that, LPS, lipopolysaccharide, is released within 3 hours after concussion. So how quick do you want nutrition? How quick do you want to treat them? ASAP. With that being said, nutrition is a critical element because you want to be able to adhere and help those axons, those tissues, and the gut heal. So I can share you some insights into which nutritional supplements or ingredients, diet. So if someone comes in today and they just had a concussion and they've already been diagnosed, and the diagnoses that are out there is I use what we call the visual oculomotor screen. You can download it. It's 2 to 4 pages. Everything's going in the eye. It's all about eye and head movement. Another very easy test. It's called the heel to toe test. We used to call that, I'm not sure how old you are, but when I grew up, it was walk a straight line, see if you were drunk test.
Yeah. the cop test, we call it.
The cop test. So if you can't walk a straight line, you have some problems. MRIs now have been very, very effective, and there are newer blood tests now that are really speaking to the idea, and spit tests being very specific for concussion. With that being said, you want to get specific nutrients in. So high level, when you look about it, fish oils. In an acute state, grams and grams of fish oils, 15, 18 grams of omega-3 fish oils, DHA most prominently, in the triglyceride form. I'm going to say that again, in the triglyceride form, because that's a critical element. So many studies and so many stories I've heard from people have said, I only gave them 2 or 3 grams, not in the brain in acute state. In addition to that, the pro-resolving mediators are a great choice because they allow for the decrease in inflammation in the brain. Magnesium L-threonate. Magnesium L-threonate is a great choice because it's been studied by MIT, came out in September of 2016, and is shown to decrease brain aging by 9 to 14 years. It also makes more bioavailable magnesium in the brain by 50%, 15% in the cerebral spinal fluid, and because you're more susceptible to Alzheimer's after a concussion, decreases your incidence of Alzheimer's by 80% if you have the APOE4 gene. Turmeric. Turmeric's a great choice because it decreases NF-kappa B. Vitamin D is also shown to be great because it puts the brake in an inflammation in the body and also increases the use of heat shock proteins. Choline's also great. Phosphocholines a great choice. Zinc, boswellia. Boswellia has been shown to decrease diffuse axonal injury. Coffee fruit extract. L-glutathione. Glutathione decreases brain tissue damage by 70%. And the first thing I do when someone comes in is I get them into ketosis. Ketone bodies fuel the brain much quicker than sugar. So I'm going to give them some MCT oil and I'm going to give them some ketone salts, get them into ketosis. If someone has a neurodegenerative disease and or a concussion, do not give them sugar. The brain is 60 to 70% fat. Get them on a ketogenic diet. That's what it was made for.
That's massive because, as you probably know, in common sporting environments, oftentimes sugar is given very consistently on the sidelines, right? So right after concussion is sustained, sugar might be administered to the patient or administered to the person, and that can further cause inflammation and shift the person away from that healing state. The other thing that you tend to talk about a lot when it comes to concussions is protein. So along with the ketogenic state is make sure that their proteins are increased as well, right?
Yeah, well, it's a great point because, keto is about 70, 75% fat and 20% protein. You mix those two together, you're giving it energy and the ability to heal. And unfortunately, post-concussion, the body can't even process carbs. And you're right, as soon as they get hit, what do they give them? A Gatorade, let's say, or a Powerade or something like that, a fructose, dextrose sugar with artificial sweeteners, artificial coloring, et cetera, et cetera. And it's just a drink of death for brain cells.
Absolutely, yeah. Hey, before we go too far here, can we backtrack a little bit and can you expand on PRMs and just exactly what those are and how they're used therapeutically? You've touched on them quite a bit here, but just want to get a little bit more specific on those.
Pro-resolving mediators. Essentially, fish oils should be anti-inflammatory, but they're not able to convert to that last leg because our bodies are not able to convert them. The metaphor that I use is how well does flaxseed oil convert to EPA and DHA? Poorly. Flaxseed oil is great. It's an omega-3, but only converts between 3 and 5%. The same thing occurs from omega-3s. They're not able to make the conversion to these resolvents, these maricins, and these protectants. So they are the precursor, these PRMs, they are the precursor to these resolving mediators. What's most interesting is there's 2 things to make note if you use them. Number 1, you do not want to take them with NSAIDs or COX-2 inhibitors because they shut off the conversion. They basically stop the lipid class switch at the cell membrane when the macrophages come in, and the macrophages now have been stimulated to be resolving macrophages. Macrophages are the captain of the ship of inflammation. They talk to neutrophils and leukocytes. In addition, you should take them not in place of fish oils, in addition to fish oils. You get that combination, triglyceride form fish oils. You do that, and you're going to see people's inflammation precipitously decrease.
Again, such a great point that we just don't talk about enough. So I'm glad you specified and drilled down into that. Again, that's something that's in your book. So if people want more information on that, they can review that there. Before, again, we jump on, one last thing to clarify, you'd mentioned blood testing for concussions is becoming more and more common now. Can you touch on that a little bit in terms of assessment? What would you typically run from a blood testing perspective?
Well, you know what I'm running now the most, there are some tests that are 97 and 99% accurate, but they're hard to do in the office. I'm testing the blood-brain barriers. So
Okay.
unfortunately, most doctors aren't going to see somebody in an acute state. They're going to go to the emergency room, their family practitioner, and they're going to see them day 2, day 3, or week 3, 4, maybe a month later. With that being said, we've got to test the blood-brain barrier. So I'm a big proponent on obviously barriers. So I believe barriers are a critical element. You know, it's so funny when you talk about barriers, people say, well, what's the big deal? Well, you know, if you rip your skin, you put a Band-Aid on it. Well, you can't put a Band-Aid on your gut. There's no way I can get inside. But think of this, when you have a tear in your gut, things go through your whole body system, and somehow, some way, people don't get as scared. If you have a tear in your blood-brain barrier, you're guaranteed everything that's not supposed to go in your brain goes in your brain. And that's why, as you alluded to before, the gut is what we've talked about, but it should be at the brain and the brain barrier levels.
Yeah, we should be talking about it more. Absolutely. Okay, so let's transition now into, we went from the gut up to the brain, and now we're going to go back to the gut and talk about how a traumatic brain injury or a concussion can actually cause problems down the line in the gut. We'll touch on SIBO first, and maybe just at a very high level, let's talk about what is SIBO and the difference between methane and hydrogen dominant SIBO, just so that people have that foundation to work with.
Absolutely. Fabulous. So one of the reasons why people have SIBO post-concussion, and actually it's up to, in different pieces of literature, up to 60%. One of the biggest problems is, once again, that vagus nerve. So when that vagus nerve gets decreased, you're typically sympathetic after concussion. So the parasympathetic system, your vagus nerve shuts down. When your vagus nerve shuts down, your vagus nerve is critical for, and this is why you get SIBO, or one of the reasons why, but it overrides it. Your digestive enzymes, your bile gets shut down, and your pancreatic enzymes get shut down. In addition, you referred to MMC, your migrating motor complex or migrating motility complex, which is peristaltic contractions in your small intestine, which should occur 9 to 11 times per day. When after concussion, your vagus nerve shuts down, it only moves 3. So therefore, you're not moving your food bolus. In addition, your ileocecal valve, which is your doorway between your large intestine and small intestine, it is not a valve, it is a flap, doesn't close, and then you get a regurg, if you will, from your large to your small intestine, because SIBO, small intestinal bacteria overgrowth, should not have bacteria in your small intestine. It should be pushed through. So when you have an overabundance of bacteria in your small intestine, you get SIBO, which is symptomology very similar to leaky gut. So I'm going to say this here. We're going to come back. We're going to talk in 3 years. And I'm going to say I think most people have leaky gut, but people don't realize they also have SIBO. We know that they get SIBO from irritable bowel syndrome or disease because that's large intestine. But most people don't realize that they have SIBO because the tests how we haven't got to the highest level. So methane and hydrogen is a breath test. So methane, usually if you blow positive for methane, usually implies that you have constipation with it, where hydrogen's associated more with diarrhea. SIBO is typically associated with IBS or diarrhea IBS. So I hope I tied that all in one tight bow.
Yeah, that was perfect. And yeah, quite frankly, I have to agree that the amount of testing that we're doing now with SIBO, we're seeing in our clinic every 2 to 3 patients or so are testing positive for SIBO. And there's, it's multifactorial, and having a concussion or a traumatic brain injury is part of that. But, stress affects the MMC, having IBS previously or other types of digestive issues due to an inflammatory type diet is going to push things up the pipe. And that IC valve is critical in understanding what's going on between the gut and the small intestine. So you touched on a lot of awesome things there. Let's now talk about exactly what happens when someone sustains a concussion and how that directly ties into a diagnosis of SIBO. And I'd also, if you could end that with, how do you explain that to patients so that they get it in a way that the brain injury is actually affecting their gut and vice versa?
Well, it's a great point. So I asked them, do you have any gastrointestinal upsets? And it brings me to a lot of stories with patients. And they go, yeah. So I had a patient that came in, female patient, Ivy League school, captain of the lacrosse team. She came in and she says she sustained multiple concussions. I said, before I look at your intake form, how's your gastrointestinal tract since then? She said, it's very funny that you mentioned that. They now think I may have, which she didn't. They now think I may have celiac. Did you throw up after the concussion? Oh my goodness, I threw up. Well, symptoms will lead you to the sign that something's wrong in a system. So if you hit your head, why are you throwing up? Because your gastrointestinal tract or your GI tract is intertwined with your brain, and it gets back to that vagus nerve because it's your rest and digest nerve. So when it gets shut down, you can't digest. So she regurgitated, and all that those issues caused. Now, interesting. I said 3 hours after a concussion, LPS gets elevated. If you have LPS, you have leaky gut, that pipes it back up to the brain. So if you're just trying to fix the brain and you're not addressing the gut, you're not looking at the bidirectionality. You're not looking at the full system tie. Remember, there's only up to 14 systems in the body. As long as we, as you put it, connect the dots, we're plausible for a clinical outcome. So that story usually resonates, and many of the people have hit their head. Again, another story where I have a 12-year-old came in. He's an elite rock climber, and he came in and he was suffering from concussions. And I asked him and his mom, and I said, he's got psoriasis. I said, did he have the psoriasis first or did he have the concussions first? She said he had 5 concussions before he had psoriasis. So connect the dots. There you go. He damaged his gut. We tested him. Psoriasis is obviously autoimmunity at the skin level, comes from inside. It's not here, it's here, etc. So when I'm able to do that, and that's how you really want to talk to all your patients, go through their history. You'll realize it's there. That's a great term. Connected dots for the patient. They will have their epiphany, the light bulb will go off, and then you're going to be talking about common ground.
Yeah, and such a big part of this medicine as well. Doctors, teacher, again, taking the time to educate the patients so that they get those connections and are compliant with the treatment plans down the road, because then they are understanding why they're actually doing what you're telling them to do. So that transitions us into, can you give us some examples of, some particular case studies? You just gave us some, but some case studies and protocols in, some tough cases that you've had, or, cases that you really had great outcomes, to show how you connected those dots and then how you implemented a treatment plan and brought it full circle so that the patient was on their way feeling a lot better.
I'll do it with concussion. So I have one famous race car driver, and he always lets me talk about his case. I won't mention his name just because I don't want him getting flooded with emails after this. So he had seen a lot of practitioners. They really didn't, as you said, connect the dots, and he had Crohn's disease. Now, when a guy calls you up and says, I am going to be your best patient, I will drink motor oil if that's what it takes to get better. So when you hear that, you roll your sleeves up, you're in. So we went through that 7-hour program, great feedback, got the clinical outcome. He is now the poster boy. He works with the Crohn's. A more personal thing, one of my patients had come in and she had been everywhere, and she was suffering from tremendous depression after hitting her head. Tremendous depression. And she just wasn't treated correctly with concussion, had a lot of gastrointestinal issues, 20 pounds lighter, applied the protocol, and she felt better. But that was a time where I didn't believe everybody had SIBO, or enough to check that everybody who had a concussion had SIBO. So we went in and did a SIBO protocol. So within the SIBO protocol, in phase 1, in the first 30 days, I increased bile flow with bile acids, taurine, and digestive enzymes. Then I used, in addition, oregano oil, berberine, and I also used Saccharomyces boulardii. I used a separate formulation that had zinc carnosine, and I had an option between 2 diets. I had an option between the FODMAP, which has really poor compliance, and if you Google the FODMAP, you'll have 5 different FODMAPs on 5 different Googles. So it's either the FODMAP, but don't eat any carbohydrates, or put her on a ketogenic diet. With a concussion, I chose the ketogenic diet. Did that for 30 days, then switched to a 60-day program where I did a gut restoration formula, again, the powder. Switched from the Saccharomyces boulardii at that point to regular bacteria. always keeping the bile flow. You know, it's interesting. The small intestine has its own mechanism for being healthy. It's peristaltic contractions, it's digestive enzymes, it's bile enzymes, it's pancreatic enzymes. Anytime you stop any one of those 3, 4, 5 needed things, your ileocecal valve, you're now susceptible to SIBO. So I took her through that and kept her on continuously a gut protocol, which incorporated things to increase bile flow, a probiotic, and again, gut restoration. After that 90 days, no more SIBO. Interestingly enough, 2 studies have come out since I've worked with her. Study number 1 says you can give a probiotic on day 1. And study number 2 says if somebody has IBS and you give a probiotic without SIBO, their symptomology goes away about slightly over 10%. However, if they have IBS and SIBO, 4 different strains, 71% of the people's symptomology decreased. So if anything, probiotics are a critical element to incorporate in somebody's SIBO protocol.
Can you list those 4 strains?
Okay.
Oh, sorry, I put you on the spot.
It's all right. It's good. It's acidophilus. It's B-lactam. It's plantarum, and I think it was rutai.
Awesome.
No, okay. It was rhamnosus instead of rutai.
GG?
Sorry about that.
By chance? Yes. Yeah. Okay. So we can reiterate that after the fact as well. If we'll have some show notes.
I can cite the source. If I got the 4th one wrong, we can cite the source. Beautiful. I'm almost ready to get my laptop now. Stephanie's writing that down, shaking her head. I got a thumbs down. Oh my God. My mom's coming in.
Whiteboard behind that you usually have there to write things down.
Yeah, that's a great idea. I think I'm going to do that next time. There you go.
So I just want to touch on one case that you listed in your book about a soccer player who had sustained multiple concussions. Maybe that was the same one that you just mentioned earlier. But you got her back into the game within 3 weeks. 3 weeks, you turned her around. And that ties into what you had said earlier about the fact that we're not focusing on rest as much as we are focusing on activity and active movement after concussion now. Can you quickly speak about the assessment and the protocol that you did with her and how you got her back into play so quickly?
Well, you know, it's funny you mentioned 3 weeks because the time frame's critical because the new literature says that myelin sheath post-concussion takes 2 weeks to loosen. And it can take up to 2 months to heal. 93% of professional athletes go back to their athletic event within the first week. So the timing was critical. So when you think about it, nobody should go back post-concussion according to that study in the first 2 weeks. So the reason she was able to get back so quickly was it was a mild concussion. She came in acutely, and I was able to apply within 60 minutes of the concussion the nutrition that was needed. I use a lot of laser. I was able to laser her brain. I was able to laser her vagus nerve. I was able to get her into ketosis right away. And I was able to get her on activity. And the activity that you're looking for is steady state. The reason steady state is you don't want the head to move too much because if the head moves like I just did, the problem is it'll increase the symptomology. And steady state is picked like an elliptical, a walk, a treadmill, etc., because you're in there. So swimming doesn't work. And she responded. I held her out for 3 weeks. In theory, she could have stayed another week or 2. Probably now I would have, but it's all worked out. And fortunately, because she came in with the hour, she did not start to have the gastrointestinal issues that so many people do because they just wait too long.
That's amazing. And unfortunately for a lot of amateur athletes, they're not going to be able to have access that quickly. So I think awareness building is massive in this space. And if you're a practitioner who works with athletes, continually reminding them that if something happens, come in fast and start dealing with this as quickly as you can. So Dr. Rob, we're running out of time here. I just want to wrap up with a few fun questions, 2 of which are the first one, we talked about routine. So what is your morning routine?
Well, my routine is when I get up, I'm the first one up in the house. So one, I'm really happy that I'm up because it implies that I have another day to try and help a whole bunch of people. My routine is I go down and I start brewing the coffee. That's my job. It's the only thing that I can prepare adequately without burning the house down. So I'm an organic coffee because I believe that organic coffee comes with coffee with benefits. I sit down and before I open up that phone, I write my 5 things down. I write my 5 gratitudes. And then I write 5 things that I want to accomplish during the day. I then drink my coffee and I immediately start saying, what did I miss last night in sports for 2 minutes? And after that, I go right, because, I got to see my basketball. I'm a fanatic. And more so than that, I start looking at different articles and everything like that and see how that pertains to the day. But I start the day with my gratitudes. And one of my gratitudes is I get to drink my organic coffee.
Do you put some coconut oil in there? Is it,
I have a little keto mix. I do.
Yes,
I have
yeah,
a little mix.
okay.
And I admit I have a little coconut sugar. I maybe have 10 calories of coconut sugar. So I don't want to lie.
Hey, great way to start the day. Nice and simple. Okay, last question. If you want our listeners to walk away with one key message or one key lesson, what would that be?
Well, here it is. Health is wealth. As Jim Rohn once said, take care of your body. It's the only place you have to live.
Amazing. I love that. Okay, you've got a new book coming out. It's coming out later this year. That's super exciting. Can you quickly tell us a little bit about that?
Absolutely. It's all about the gut-to-brain axis. What a shock. And right now, the working title, we'll work on it some more, is the superhighway to health. So I'm going to really explain in detail what we talked about in that the gut to brain. We're also going to have a section on the microbiota, gut to brain. And now we're adding the microbiota, gut to heart to brain. So gut to brain, three-way calling, microbiota, gut to brain, conference calling, microbiota, gut, heart to brain. Protocols and the like, and we're going to have a special section on how to assess and treat a concussion with flowcharts and, yes, recipes. I promised everybody this book, you'll get recipes because the practitioners need to share the recipes on what to eat with their patients.
Flowcharts and recipes. That sounds exactly
flowcharts and recipes, what everybody always wanted when we went to school.
Exactly. Superhighway to health. You're referring to the vagus nerve, obviously. That's a really great name. You can keep it at that, but that sounds great. So keep an eye out for Superhighway to Health. Check out Inside Out Health, Dr. Rob's #1 best-selling book in 2016. If people want more information about you, where can they find you?
Okay, real easy. My website, drrobertsilverman.com. Come visit me. Do a lot of social media. So the two big ones are Facebook and Instagram, drrobertsilverman.com. And we've got, which I'll invite you on, we've got our own webcast called Proven Health Alternatives.
Awesome. Beautiful. Thank you, sir, for joining us today. We will see you next week at the EPIC Functional Medicine Conference. Have a great time until then, and thank you again.
I will see you there, and guess what I'm talking about? The blood-brain barrier.
Can't wait. Hey, thanks everybody for checking in as well. We really appreciate it. Wishing you all a great day. We'll talk soon.